All right, it looks like several of you have been able to filter into the webinar. Fantastic. I want to say a good morning, good afternoon, good evening, wherever you are in the world. Welcome to today's webinar. Our webinar presentation today from the International Students and Programs Office and Student Health is focusing on student health and immunization requirements for undergraduate students. Do know that the session for today is being recorded, so if you miss any information or if you want to come back and review anything, this is being recorded and it will be available within usually about the next week or so at iwebinars.ucsd.edu. So I just want to take a moment to introduce the staff who are here to support you today. My name is Gabi Hoffman. I'm the Assistant Director for International Student Experience and Engagement at the International Students and Programs Office. We're joined by Jill Batika, our Billing and Insurance Manager from Student Health Services, and Annie Horton, Nursing Supervisor for Student Health Services here at UC San Diego. We're also joined by my colleague, Grace Fuller, who is our Manager for International Student Experience and Engagement here at ISPO. So I want to just briefly go over what we're going to be covering today so you have an idea of our topics. We're briefly going to go over the International Students and Programs Office, who we are. Hopefully you know who we are by now, but we'll review that briefly. We'll be going over ISPO's First Steps Checklist, so our iNew student site. Then we'll be going over student health services, immunization requirements, and at the end we'll be wrapping up with some reminders about upcoming webinars. And we will be allowing for Q&A. So if you do have any questions, we do ask that you hold those to the end of the presentation. We will be covering a lot of information, so just hold those until the end and we'll be sure to answer them for you. So speaking of question and answer, all of you in your webinar panel should see a little Q&A box there that allows you to ask questions of all the panelists. What we tend to do is we will, if we see a question that is applicable to the group would benefit from the answer, we'll ask that question out loud. We won't identify your name or anything, but we will ask the question out loud and answer it out loud so everyone benefits from the answer. So feel free to use this toward the end of the webinar when we open up the Q&A portion. Okay, so now I want to briefly go over the ISPO website, our First Steps checklist that I mentioned just a few moments ago. So for all of our newly admitted students, our undergraduate students, we have a page specifically for you. So if you haven't seen this already through our email communication, the inewstudent.ucsd.edu site is part of the International Students and Programs Office website that gives very specific information just for international students. So as an undergraduate student, you'll see there that you can learn more under the bachelor's level students button there, which will take you to the International Undergraduate Students page. There you'll see laid out the various different steps you need to follow to get started as an international student. So it's everything from requesting your visa documents to learning about the visa application process, webinars, different things you need to accomplish before you get to campus. Those are all outlined here. So we definitely recommend you take a look at that site. It has all the information you need to get started. Okay, so now I am going to go ahead and turn it over to my colleagues to begin the presentation on student health services here at UC San Diego.
Good morning. My name is Jill Batika and I'm the Billing and Insurance Manager here at Student Health Services, which is a comprehensive primary care physician clinic on campus. If you fall down or get hurt or you're sick and you need to see someone, we are centered right in the middle of campus on Library Walk, right down from our Geisel Library. And we have just about 40 practitioners here, medical doctors, doctors of osteopath, registered nurses, nurse practitioners, and other medical staff that can assist you. We're going to talk about the insurance requirement and what services are offered at our student health and how they get paid. Our agenda, what is student health? Student health is a campus provider where you can get medical services, We're going to talk about your enrollment in SHIP, and SHIP is an acronym for Student Health Insurance Plan. Filing a health fee waiver if you want to avoid the cost of the student health insurance plan. Fee-for-service options, which are cash-paying services here in our clinic. Enrollment in our RAFT, and RAFT is an acronym for Reduced Access Fee for Tritons. It's a $65 fee that students pay to come into the student health clinic if they waive the insurance requirement. And then contact information, so you can ask us any questions by way of email or giving us a call. Here at Student Health, we're here on campus all year round. We're one of the only entities that is available all year round. We're open during winter break, spring break, and summertime. During our regular campus academic year, we're here Monday through Friday. Mondays and Tuesdays, we're here from 8 until 6. We extend those hours. Wednesdays and Fridays, we're here 8 to 4. Thursdays, we're open from 9 to 4. Saturdays, we're open from 9 to 12 for our urgent care needs, and our pharmacy is available to you. And that is for all quarters, fall, winter, spring, and summer. If you want to make an appointment, you can do so. Our phone number is there for you. There is not an online option to make an appointment right now, so you'd have to give us a call. And our after hours advice nurse line is available to all students, no matter how they're paying for services. And that's available all year round when our campus student health is closed. You give us a call and one of the nurses will assist you with your needs. As an academic requirement through your registration, all students are automatically enrolled in our UC SHIP program, which is the University of California Student Health Insurance Plan. And it's one of the registration fees that you'll see on your student account. If you want to opt out of it, you can, and we'll talk a little bit more about the waiver process. But every single student is automatically charged a fee for the insurance. For this academic year, we're charging $680 per quarter, and that amount goes up each school year based on utilization and how the students use that. This year, academic year 2021, we'll be charging $692 per quarter. So it did go up $12 this year. So be prepared for that. If you do want to keep the health insurance, you will have to pay that on a quarterly basis. But if you look at it on an annualized basis, it's very affordable, comparable insurance that covers many things. And you might want to compare it to other plans that are offered in the United States. Our plan is covering you 365 days a year if you are paying on the quarterly basis. The spring tuition payment includes the summertime. There are no summer registration fees, so you're paying that $692 3 times per year, fall, winter, and spring. And then that spring is about 6 months in duration, and that carries you up back until the fall quarter of the next academic school year. Most services at our student health clinic are at no cost. So if you have the student health insurance plan and you call and schedule an appointment, you're not paying for the office visit, the lab work, x-rays. The only thing that you would be paying for would be a prescription copay, or if you don't make an appointment, we offer you our urgent care, and there's a $20 copay to come in that way. The SHIP insurance includes medical coverage, $1,000 worth of dental care through Delta Dental PPO, an unlimited pharmacy plan, and a limited vision plan where they pay for an annual eye exam and 1 pair of glasses or contact lenses each school year. If you are a student that needs coverage when you're traveling outside of the U.S., the insurance does cover you worldwide. It is at a reimbursable rate once you leave the United States, but it is covered at 60%, where most plans that are initiated out of the United States don't cover you globally. So this is a great program, and you might want to take a look at the benefits. They are on our website now. One of the great facts about coming to UC San Diego is that we're affiliated with 3 acute hospitals here in our community, and they are right within, some of them are within walking distance, or we have a bus that goes to and from the facilities that you can go to see a specialist or go to the emergency room, go to an urgent care. So we're very lucky to have these 3 hospitals nearby. As a member of the SHIP program, Student Health Insurance Plan, If you're utilizing a University of California medical system provider, you get better benefits. We have 400 specialists here in San Diego, and we have the 3 acute hospitals where we can service any kind of illness. We are the curative center of San Diego, and a lot of our community comes to UC to get their health care. Under the UC system, services at the hospital for diagnostic and surgical measures are covered at 90% with no deductible. That means you're not paying anything up front. And if they do see a specialist, it's a $10 copay to see that specialist and evaluation. If you are using a hospital service for diagnostics, it's 10% out of your pocket. They'll send you a bill in the mail. It's not associated with your student account. And we will walk you through that process if you do come to the student health clinic. We'll help you get the referral, get the appointment, and also let you know what your benefit coverage is. Under the plan that you have, it's an Anthem Blue Cross PPO plan. Under the second tier of benefits, you are allowed to use an Anthem Blue Cross network provider under their PPO network at 80%. Unfortunately, you have to pay $500 up front. So $500 is a deductible if you have any diagnostic or hospitalized services. You pay the first $500 of the bill and then 20% of any remaining bill. If you see a specialist, it is just a $30 copay out of pocket, or if you go see a primary care physician outside under the Anthem network, it's a $20 copay. All services do require a referral, so you would need to contact us here at Student Health to initiate that. There's a third tier of benefits under this insurance plan for the medical side, and that's out of network. And that would be your global coverage as well as going to see a doctor that doesn't contract with the insurance. That's called out of network, and that's covered at 60%, but you have a $1,000 deductible first. So you'd pay the first $1,000 of bills and then 40% of any remaining bills. We highly discourage this because we know that you're limited on your funds, and who wants to pay that for medical care? Under the insurance, we don't mail out insurance cards or benefit booklets. It's a mobile application that you can download to your phone. Student Health, all one word. If you install that application, that'll give you a copy of your insurance card as well as benefit information, and you can also watch the claims process, see if claims are being paid or what your financial responsibility might be in that process. Under our University of California Office of the President, they do include all of the benefits online. Their website is there for you, ucop.edu/UCShip, or you can go onto our UCSD website at studenthealth.ucsd.edu to get more information about benefits or to find out details if you're looking for something specific. If you have insurance that you want to use instead of the school insurance, you have to act on that and you have to opt out of the program. So you're automatically enrolled as a student. If you don't want the coverage and you don't want to pay for that, you have to file what's called a health fee waiver, and that's found on the Triton Link website. You go to your Triton Link page, click on Financial Tools, and then Health Fee Waiver. It'll ask you to sign in with your single sign-on through the school, and then you answer a series of questions based on your insurance, and you can usually get the answers right off of an insurance card or insurance policy information. To file a waiver, it's very important that you follow the timelines. The waiver is open now on the Triton Link. It will be open from May 1st to September 1st, 2020. There is a late waiver filing period that'll be open from September 2nd to September 9th, but you do have to pay a $50 late fee if you file your health fee waiver during that time frame. Your insurance must meet the Affordable Care Act here in the United States. Your policy must be unlimited in the payout that it will pay to medical providers and hospitals. And it has to be written in English and reimbursable in US dollars. If you file a health fee waiver during the May 1st to September 1st timeframe, you will be waived for the entire academic school year, but you do need to resubmit that waiver every school year. As an international student, I know that it's a lot of money to come here to the United States, and that insurance requirement is expensive. We do allow students to purchase outside plans, and I have 3 of them that we do recognize through the office of our president that would be acceptable to waive the insurance requirement. They are all online. ISO, we will accept their care plan or share plan. If you wanted to go on to PSI, we will accept their platinum plan. Or if you wanted to go into student Medicover, pretty much any of their plans we will accept. It's managed by United Healthcare. But you would have to purchase that plan and have coverage for the entire school year to meet the waiver requirements. But it is an option for you to purchase that plan and waive. Students that waive the insurance requirement still can come into the student health clinic, but you're paying as you go. So you're paying cash or you're paying a credit card before you leave the clinic. And if you don't, we will transfer it to your student account where you can pay it later, but it is an added financial responsibility to you. In order to come into the student health clinic to see a practitioner, it's usually about $99 to see a primary care physician. Any added lab services are about $20 each. To have an x-ray in the next academic school year, it'll be a $50 charge for each x-ray. So think about that when you're filing the waiver. If you wanted to cancel a waiver because you need to have a surgery, or if you need some medical care that you think is going to be expensive, you can cancel your waiver, but you have to do it during the open timeframes prior to the start of each quarter. And those timeframes are listed on our website as well as the UCOP website and Triton Link website. But you can change your mind, and we'll help you with that. We'll help you cancel the waiver, and we'll also get you enrolled into the insurance so you can have that coverage that you need. The cancellation form is found on our student health website if you are interested in that. If you do file a health fee waiver and you don't pay for the school insurance, you can add a raft, and a raft is a reduced access fee for Tritons. It's a $65 fee that you pay per quarter, and that allows you to come into the student health clinic and have as many scheduled appointments as you'd like. It covers in-house lab services, like a complete basic blood panel, and you're paying that $65 fee per quarter. You're not paying anything additional when you come into our clinic. So it could pay for itself in one visit if you came in paying cash and paying that $99 primary care physician visit. So it is something to think about. It is not an insurance. It's basically a membership to come into the UCSD Student Health Clinic and have a scheduled appointment. If you needed to have further services, like a specialty visit with a provider, or you needed to pick up a prescription, we would refer you back to your home insurance where you could use that at an alternate place to pick up your prescription and have that paid for by insurance, or we would send you to a contracted provider under your insurance to see a specialist, so that's covered under your insurance. RAF doesn't replace any ongoing care that's obtained through a primary care physician. If you're seeing someone now, it doesn't pay for any of that. And it does not include pharmacy, send out lab services. So if you need a specialized lab, it's not going to pay for that. It doesn't pay for our optometry services or immunizations. And again, if you look at our website, it'll give you all of the coverage information as well as what RAF truly is. And it's basically a membership to come into the student health clinic and have services at no additional cost during the quarter. If you have questions about the services that we provide at Student Health, or if you have questions about the insurance requirement, what may meet it, anything like that, please, I encourage you to give us a call at our phone number there or email us. Also, during the regular school year, when you're here on campus, hopefully soon, you can stop by and see us in our insurance office. And as I said, we are that brown building in this slide. We're right across from the bookstore, centrally located on campus, right down from our Geisel Library. Thank you for your time. And if you have any questions, I'll be glad to answer them after the presentation.
Good morning, everybody, and congratulations and welcome to UCSD. My name is Annie Horton. I'm the Nursing Supervisor at Student Health Services. I'm here to talk to you about UC San Diego's incoming health requirements and how you can achieve those. What are the incoming requirements? The University of California in 2016 mandated that all incoming students complete TB screening and prove immunity to certain communicable diseases as recommended by the California Public Health Department. And you can see on the slide there that it includes the screening. Our system will determine whether testing is needed. And the immunizations include Tdap, which is tetanus, including pertussis, measles, mumps and rubella, varicella or chickenpox, and meningococcal MCV4. Proof of vaccines or immunity via a blood test. And we do have exemptions, but these are for medical reasons only. Why do we have health requirements at the University of California? It's basically to protect you. It's to reduce the likelihood of vaccine-preventable disease outbreaks from occurring on campus. The nature of campus life includes a lot of contact with people. Therefore, there is a higher risk. And we want a higher level of immunity to protect those most vulnerable in our community. How do you start this process? Student Health Services administers the incoming requirements, and these are housed within a secure UC San Diego Health electronic medical record called EPIC. The student portal is called My Student Chart, and it's activated by your AD login, which you will receive shortly after accepting an offer of admission. When can you expect to access it? If you have accepted a position in the university, you will see here the date range that you can expect to access it. Most undergraduate students will be in our first load, which is on Friday, May the 15th, and it occurs every month after that. When you get into My Student Chart, this is the homepage that you will see, and there are several ways of getting into where you need to go to meet these requirements. One is through the health tab, which takes you to an immunization and screening section. And otherwise, everything else is highlighted links on the landing page there. All of the forms that you need are actually on this landing page. And it's a really good idea to check out the immunization form before you go in to add it to your online record so that you can see exactly what's expected of you. You can take this to your health provider if possible, and this can all be filled out. This is what it looks like, the next screen once you go into our requirements. The first one is TB screening, and that is where the questionnaire is housed. And the second one is the immunization history screening, which you enter the dates and you upload vaccine records and or our form. The first requirement is the tuberculosis. We want to prevent anyone with active TB from coming onto campus. Please ensure your testing is done prior to coming. If you have completed the TB risk questions, the system will let you know if you are required to do testing. If you're coming from outside of the US, it is highly likely that you will need testing. There are a variety of tests that are acceptable. The blood test is the gold standard, but skin tests and chest x-rays are also acceptable. It's important to begin this process as soon as you can. If there are any issues that arise in testing, it can take considerable time to get clearance. All records must be in English, please, including the chest x-ray report. And it is important to supply us with all the requested information on the testing form. Failing to supply us with all that information will result in a delay of the clearance. Our nurses that clear all of the requirements will message you if there's something missing. So it's very important that you go back into My Student Chart and check your UCSD email to see if we've reached out to you to let you know that something additional is required. The second compliance is the immunization, and you can see the deadline there is November 1st. You need to obtain all of your vaccine records. you need to gather everything first. Then you know the dates that you need to enter into the system. And if you do, it is an advantage to take our form to your health provider because they can provide you with anything that's missing. This is what the immunization page looks like. You can hover over the info bubble next to any of the vaccinations and it will give you a lot of information if there's anything that you need to know. If you have had blood tests to check for immunity, you will be also requested to upload the lab result. At the end of the form, you will be asked to upload your vaccine records and/or the form or both, either is acceptable. Once you've done that, one of the registered nurses on our team will review the submission and again, just like the TB, will reach out to you if there's something missing or something unclear. Common reasons to not meet the immunization requirement include having the vaccines too early or they're not properly sequenced. Tdap is a vaccine that can be obtained during our fall flu clinics. How can you get help if you need it? Once you've been able to get into My Student Chart, there is an Ask a Nurse question. You can send any question, and we have a lovely team of nurses here that will respond to you and help you achieve compliance. There's also an email address that you can see on the screen. This is really only if you're having technical difficulties. Please don't send any health information to this because it's not a safe way or secure way to send health information. But if you're having trouble signing up, if the system is not accepting your documents, those types of things, you can email us on that email address. There are several places you can also go to gather more information. Student Health Services has a very robust website, and there is a page dedicated to the health requirements, and all of the forms are there, as well as the forms for medical exemption. There's the immunization compliance policy there, so there's lots and lots of information. Don't worry about the graduate division website, but the Triton checklist also has access to all of this information, and you'll see it on there once you accept admission. Please do this as soon as you can to avoid enrolment holds being placed on your account. We want to see you succeed in achieving your compliance, and we are absolutely here to assist you. So please reach out and we will help you as best we can. We are living in a time of a high level of uncertainty. So please reach out to us if you're having difficulty accessing healthcare or any other issues. And we will also be messaging our student body with any updates as it relates to COVID-19. Thank you.
Thank you so much, Annie and Jill. Just a couple of reminders I wanted to go over before we open it up for questions for my colleagues. For those of you who attended today, we're hoping that you can join us for a future webinar. Our next webinar we are holding is going to be on May 21st. So this is going to cover the topic of undergraduate student housing, going over both on-campus and off-campus housing for fall. Again, as Annie mentioned, this is a very uncertain time, of course, but we're hoping that we can provide as much information as possible to help you prepare for fall quarter. And the housing team will be able to provide that information for you as well. Our next webinar after that, our date is to be announced, but it should be shortly, is we'll be hosting a webinar from fellow students here at UC San Diego, international students, about student life and getting involved on campus. So they'll be able to give you a first-hand look at what it is to be a student at UC San Diego, what their experiences were, and so forth. So that's going to be a great webinar, particularly for our new students looking to get involved, get adjusted to campus at UC San Diego. All of our webinars will be recorded and posted at iwebinars.ucsd.edu. Okay, so now I'm going to go ahead and open it up for questions to see if we have any ones for our staff today. Let's take a look here and just see. So Annie and Jill, we have one question asking, is there a particular place, an authorized center or place to do immunization and TB screening?
Sorry, can you repeat the question for me, Heather?
Sure, yes. One of our students is asking, is there a particular specified place, an authorized center, for example, to do immunization and TB screening, or does that matter?
No, it doesn't matter as long as it's with a healthcare provider within your community or country is fine.
Great. Okay. The next question here is, what should I do if I want to get immunization requirements done before my chart becomes accessible?
You could take the forms to your healthcare provider and gather all of the information that you need and then wait for your chart to become available, and then you'll be ready to go to upload and input all of those dates.
Great. We have a more specific question here, but I'll see if I can broaden it out to make it more applicable. One student's asking, they have a particular insurance plan that takes them into the future until 2022, but that insurance plan doesn't necessarily cover all fees. They're wondering if it's better they sign up for school insurance as well to make sure they get the most coverage.
I think that's an individual choice. We want to make sure that you do have unlimited coverage. So if you are here on campus and things happen like they have this past year, that you have coverage and you're safe here on campus. But we will review that. If you want to send us an email and give us the particulars about your plan, we can certainly guide you and let you know if this is a good plan that we would accept to waive the insurance, or if it might be a better idea for you to take the school insurance based on your individual needs.
And this is a question that hasn't come up here, but it did come up in a previous webinar. I know we were discussing it earlier. I just wanted to make it available to all. We have some undergraduate students who are interested in taking summer session courses this year. Of course, summer session is going fully remote. And our students wanted to know, is are the health immunization requirements, do those need to be completed in order to take summer classes?
No, they do not. This is, the requirements are relevant for the fall incoming.
Great, yeah, so just making sure that you all just pay attention to those deadlines that are listed that Annie and went over earlier, but they're not a requirement in order to take those summer classes. Great. Okay. Any further questions that we have for Annie and Jill in their time today? Okay, it doesn't look like we have any questions left, but we hope this was an informative webinar for all of you. Thank you so much for joining us today. If you do have any other questions, things that come up as you have more time to think about it, please feel free to contact us. Our information is listed here, or contact Student Health directly via the information Annie and Jill provided earlier, and we'll all be here to happily assist you with those questions as they come up. So thank you again, all of you, for joining us today. Stay healthy, stay well. We look forward to welcoming you this coming fall, and we will hopefully see you in another webinar very soon. Take care, everybody. Thank you.
Thank you.
Thank you.